Come up and speak is going to be Dr. Dave Orriz. Dr. Dave! Where are you, Dr. Dave? Oh, hey, Dr. Dave. Sure.
What do we want?
A public option!
When do we want it?
Now!
What do we want?
Public option!
When do we want it?
Now!
What do we want?
Public option!
When do we want it?
Now!
What do we want?
Public option!
When do we want it?
Now!
Now would be a great time. Good evening, everybody. My name is Dr. David Orriz, and I'm here to convince you. I want to thank the organizers, first of all, of Move On, for putting together this great rally, and thank you. A round of applause for the organizers for putting this together. Fantastic. What a great job. I also want to thank you, the crowd, for being here and showing up on this cold night and being part of this rally for public option health care for all Americans and people that live and work in this country. So a round of applause for yourselves. Okay. First, I'm going to say three things, and I'll be brief and quick as I can. The first thing I want to get across is that I believe, and many people do, that health care is in fact not a privilege, but a human right. There's two things I'm going to try and do this evening. I'm just going to make 2 points, and that's it. The first point is the difference between health care and health insurance. The second point I make is why we need to have a public option. The reason I'm doing the difference between health care and health insurance is that's the technique a lot of people against the public option are using to get rid of it. They're trying to call health coverage and health insurance, mandatory health insurance, as if that's some sort of public option. It isn't.
Right.
So quickly, I'll explain quickly as I can, and I have to do a little. Excuse me. I have to do a tiny bit of math. Here's the difference. With healthcare insurance, it works like this. If I'm selling you a policy, broken leg insurance for $100 a month, you pay me $100 a month every month because you might break your leg. If I have 1 million such customers, I'm getting $100 million a month. The trick is, it only costs $10 million a month to take care of all those broken legs. Do you understand the difference? So I'm collecting $80 million a month for doing nothing. Unacceptable. That's health insurance. With health care, the opposite. Health care, we as a group would only pay the $10 million, and that would be it. So it's not free, we have to pay for it, but it's 100 times cheaper. Do you understand? So health care is not health insurance. So don't be duped when they say the public option, oh, we'll have 70 million uninsured Americans, they need insurance. That's not true. We need everyone to be uninsured. That should be the goal. When they had apartheid in South Africa, the goal wasn't to get apartheid for everyone in Africa. That wasn't the goal. The goal was to dismantle and discard apartheid because it was rotten to the core. So insurance is rotten to the core, and don't be deceived. We want health care, not health insurance. Since we're right near the David Letterman Ed Sullivan Theater, I hold in my hand tonight's top 10. I know you like that one. Here you go. This is the top 10 reasons the USA should have a public option for health care. Number 10, the public option is way cheaper than using the hospital and the emergency room for every tiny medical problem. That's number 10. Number 9, it's morally wrong to deprive any man, woman, or child of access to the medicines, doctors they need, and they desperately need them. That's morally wrong. Number 8, America has many public services. We have a public subway, we're standing on top of it. We have public buses, we have a police department, a fire department. Who cares if we have one more public service, a public option? Number 7, a public option will really piss off the Republicans. Okay, 7, most popular so far. Number 6, Obama promised. Number 5, a public health option sounds way better than, and I quote, a government-funded private insurance exchange market subsidy scheme for employers available in some cases. That sounds creepy. We don't want that. Number 4, It's time for America to join the other 80 countries in the world who offer a public option for healthcare for all their working citizens. Number 3, a public option healthcare is hundreds of times less expensive than, as I explained, any kind of insurance scam. It's way, way less expensive. Number 2, it's a national embarrassment for us not to have a public option in this country. Unacceptable. And finally, the number 1 reason the USA should have a public option for healthcare is this. God damn it, the entire country is sick and tired of all this for-profit care bullcrap, and we demand and deserve not-for-profit, actual, real healthcare public option. In closing, what we want is a public option, and we want it now.
When do we want it?
We want it now. We deserve a not-for-profit, actual, real healthcare public option, not some kind of insurance scam they're trying to trick us with. Do not fall for that trick. We want national healthcare and a public option. That's healthcare, not insurance. I like to go out and chant. I've always wanted to do this since I was a little kid. So I want to go out and chant, and we can all chant with me, please. I really appreciate it. Public option now! 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 Thank you and good night.
Give it up for Dr. Dave Orez. All right, great. Listen, we've got a nice mixture of different speakers here this evening. We have a